explore the connections between TB and antimicrobial resistance. It's a really important webinar, especially since we have a UN high-level mission coming up in September this year. Stop TB Canada is a network of individuals that are passionate about ending TB within Canada and abroad. And we are very happy to be bringing to you a very cool session today with some great speakers. So I'm Petra Heidkamp. I'm one of the co-chairs of the Stop TB Canada network, and I'm just bringing some of the logistical announcements for you today, and then I'm handing it over to my fabulous moderator of this session today. It's a 60-minute session that we're having. Please use the chat for any questions that you will have. We will try and bring them up. We have a packed agenda, but if you have any questions, our speakers will try to answer in the chat, and we will try to bring it up in the moderated discussion point as well. We will try to call on you if it is possible. The session will be recorded and will be made available tomorrow. You will receive the link. You can also turn on subtitles for your use if need be.
I see Petra is frozen. I'm not sure if she is for everyone else, but I think I will just pass it over to Subesh to kick us off.
Thank you, Lee. Petra, are you there?
He has more than experience working in the field of tuberculosis and HIV. Oh, sorry. I'm sorry that you lost me. I'm not sure where you lost me, but I was about to introduce you, Subesh. So I will start again.
I think that's a good point to start. So,
so since Subesh is our moderator, and I think he has a more stable connection than I have, I'm very pleased that he will be moderating today's session. Subesh is a medical doctor with a specialization in public health. He is from Nepal, and he has worked for over 10 years on TB and HIV in Nepal. And he's currently a PhD student at the University of Ottawa. So I will not rerun all the logistical details, but please use the chat. Mute yourself if you are not speaking so that we can keep this webinar a little bit manageable. And I'm glad to pass the microphone to Subesh to formally open the webinar.
Thank you, Petra. Yeah, thank you. And thank you for that wonderful introduction. Hi, everyone. I'm glad to be here with you all today. And today we are talking about something very important, that is tuberculosis or TB, drug resistance tuberculosis, and then antimicrobial resistance, also known as AMR. So in 2016, the United Nations held its first high-level meeting on AMR. That was a big moment in global health, where leaders around the world came together to tackle this serious issue. They recognized that AMR isn't just a problem of one country, but it's a global threat that puts everyone at risk. So fast forward to now, we are looking ahead to September 26, 2024, when the United Nations General Assembly will hold its second high-level meeting on AMR. So this meeting is just not just a follow-up, but it's a crucial chance to renew and strengthen our commitment. And for TB, this meeting is particularly important because it gives us the platform we need to address the ongoing challenge of drug-resistant TB and one of the severe forms of AMR. Just a little background on tuberculosis. TB still claims over 1.4 million lives each year and remains one of the deadliest infectious diseases, even though it's both preventable as well as curable. Even though TB program had made a great start in diagnosing and treating TB, it continues to affect millions, especially in low and middle income countries. The bacteria that causes tuberculosis, which is Mycobacterium tuberculosis, can usually be treated with antibiotics, but the drug resistance form of TB, like multi-drug resistance tuberculosis, extensive drug resistance tuberculosis, or even pre-extensive resistance drug resistance tuberculosis, are making it harder to fight against TB and to end TB. When we talk about drug resistance tuberculosis, we are not just talking about TB program or TB problem. We are talking about the global health problem, a major piece of the AMR puzzle. So this upcoming UN high-level meeting is a key moment to bring TB into the spotlight of the global AMR agenda, and to make sure the fight against drug-resistant TB gets attention and resource it desperately needs. So in light of the upcoming UN high-level meeting, we are having this webinar, and we are really fortunate to have 5 distinguished speakers with us today. The session will kick off with 2 presentations, followed by a panel discussion. Like Petra has mentioned, I would like to ask you to hold your question until the end of the panel discussion, where we have dedicated Q&A session. So to start today's discussion, we are grateful to be joined by Himanshu Patel, who is here to share his experience with multi-drug resistant tuberculosis. We'll hear about how this diagnosis affected Himanshu's life and how he is now sharing his story to advocate for greater action to end TB. Himanshu is a member of TB People Canada group, which Stop TB Canada launched in 2021 as a platform for TB survivors based in Canada to connect, share their stories, and to contribute the advocacy that's necessary to end TB. So Himanshu, over to you.
Thank you, Suresh, for the wonderful introduction. And as you were saying that 2016 was a big moment for global health, I was remembering 2016, that's when I was diagnosed. So it was a big moment for me as well. Hello, everyone. For those who have joined later, my name is Himanshu. I've lived in Mumbai all my life, recently moved to Toronto, and living here currently. So as a profession, I'm into banking operations, and I spend my free time spending outdoors, running, cycling, or learning new skills. Like I'm learning how to swim currently. It's going very well. To start with, I'll first take you through what perception about TB was in my head before getting diagnosed, and my conversations with the doctor during diagnosis, and the actual treatment phase and life after that. So before getting diagnosed or before even having the symptoms, the only thing I knew about TB was that people who smoke a lot, they get TB. But I realized it's not true. TB can happen to anyone. And the difficulty that TB patients face are like weakness or just coughing. I didn't know the severe side effects of the drug-resistant TB or that drug-resistant TB exists. Moving on to the symptoms when I was having before diagnosis, I lost weight, I was coughing, I was feeling weak, and that's when I visited a doctor who, after giving me some different medicines for pneumonia, cough, he finally figured out that it could be TB, and that's when TB was diagnosed. Now, then I was referred to a chest specialist to figure out whether it's a drug susceptible TB or a drug resistant TB. I had no clue what the difference is. But my doctor told me that we'll do a test. It was gene expert test that determined that I'm resistant to rifampicin. And that's when I was officially diagnosed as a multi-drug resistant TB patient. So I was talking with my doctor, and before this, I was a very confident man. I was like, if there is anything in life, any challenges, we have to face it and do what we can. Very positive, all good. So I was having conversation with my doctor, and he was explaining me the difference between DSTB and drug-resistant TB. He told me the duration, that the DSTB has 6 to 9 months of treatment, and drug-resistant TB would take 2 years, and that the number of pills would be more. I did take medicines before for cough, fever, or such things. I've never faced any big illness before this. So I was like, okay, it's just the number of medicines and it's just popping pills. So what's going to happen? And 2 years, it's okay. I can focus on my career, focus on my life. After 2 years, there's still like 70, 80 years left, as we all think about life during our young age. So the actual difference between DSTB and drug-resistant TB I got to know only after taking medicines for a few months. I started facing side effects. That's when I realized that this is not just the difference of duration or the number of medicines, but this is a whole different ballgame. And so I did not know anyone before who had drug-resistant TB. I knew people with TB. My dad was one of them. He got cured. So I knew TB somehow that, okay, it's not a big thing, but because this was my misconception because I did not know anyone with drug-resistant TB. Now, the side effects that I was facing was very difficult, and at the point it was so difficult to continue the treatment that I was thinking before medicines I was better. The weakness, the losing of weight, the cough, those things were better than taking medicines. I was questioning whether are these medicines curing me or what. So side effects I faced were like joint pain, acidity, peripheral neuropathy. These were some minor side effects, but the severe ones, like I started hearing ringing sensation in my ears. I had blurry vision. Then psychological side effects, constant depressed and anxious. I was doing things that I loved before, but I was not enjoying it. So that was my understanding of depression back then. And after like during the end of the treatment, I had a few episodes of psychosis. So that was the most severe side effect that I ever faced. When there was dystonia and puking and all of that. So like it was messing up with my mind as well as with my body, and I was questioning whether even after I finished the treatment, because my idea was that if I'm taking medicines I'll start feeling better, but I was feeling worse. So I was questioning whether I'll be able to live a normal life or not, whether I'll be able to do normal things because I was just 23. But there's some positive to my story as well. My employers were super supportive. I was working full time during 2 years of my treatment. I just took 2 months off sabbatical. My colleagues were super sweet to share my workload. My family, my friends, they all were supportive. I cannot imagine how some of my friends who had not gone through anything like this or any other issues in life before, but were able to listen to me patiently. I'm still amazed by from where they have that quality. So those things supported me to, go through the treatment, but still it was not enough. My biggest question and worry was whether I'll be able to live a normal life or not, because I had dreams to chase. I had to do things. I was just young. I didn't want to just survive. Gladly, I found Saurabh and Devshri. Saurabh ran marathon during active treatment, and Devshri also fought for like 5 years and then went back to her architecture career. So those two stories were motivating for me, and Devashri would constantly support me with my silly, sometimes serious questions about treatment, and she was kind enough to address any question that I have and supporting me throughout. Saurabh gave me a different perspective that it doesn't have to be just surviving. You can still thrive. He climbs mountains and whatnot. So those few things helped me to go through the treatment and believe that there is life after TB and a beautiful life after TB. So I got cured in 2018. I joined ICTB, Survivors Against TB, back in India, and started counseling patients, giving them insights of how I was able to battle some side effects, how I dealt with them, showing examples of how I'm able to run long distance marathon. And if it were not for TB, I don't think I would have ever ran a marathon in my life. I wouldn't have that endurance or mental toughness to be able to go through, so many hours of just running. So that's some positive that I gained from TB. And after moving to Canada, I find it difficult to talk with patients and counsel them every now and then. So I decided to create an Instagram channel where I upload videos talking about different aspects of TB and addressing common questions and giving insights on what kept us going, where they should be focusing on and where they should not be focusing on. So, and I joined TB People Canada, where I'm participating in different forums, webinar, to share my story and answer any questions about the treatment or insights about talking with the different patients. What is the ground reality of the current TB treatment and what's going on? These are the things I'm able to share, and I'm happy to contribute and to give back to whatever I can. Because if it were not for Saurabh Devji or Survivors Against TB or any TB community that they share survivor stories, I wouldn't dare to live a life as beautiful as I'm living now. That's all. Thank you.
Thank you so much, Himanshu, to take us through the journey. It's really emotional, but at the end, it's helpful, hopeful, as well as inspirational. And thank you also for highlighting the challenge on DRTB treatment, which is a long duration with several side effects, and the importance of having new novel drugs, which is less toxic and less duration. So now moving forward with our presentation, to dive deeper into the connection between TB and antimicrobial resistance, we have two experts among us joining today. We have Yannicka Hauser, who is with Campaign in Global Health in UK, and Dr. Georgia Sulis, who is a Canada Research Chair in Communicable Disease Epidemiology, Assistant Professor in School of Epidemiology and Public Health at University of Ottawa. They are also part of the Global Scientific Panel on AMR and TB, which recently published a white paper on this topic. So Yannicka and Georgia, over to you to share more. Thank you.
Thanks so much, Suvesh, for that lovely introduction. It's really fascinating to hear also the story of experiencing MDR-TB and how challenging it is. So thank you so much for sharing that. My name's Yannicka. I'm the Policy Director at Campaigns in Global Health, which is a UK-based NGO, where I helped convene and support the work of the Global Scientific Panel on AMR and TB that we're here to talk to you about today. Georgia is very kindly sharing her screen. If you could jump to the next slide, is that all right? I'll dive straight in. So the panel emerged out of some work we did with the UK Academics Network and other partners to support academic and healthcare worker engagement in the 2023 UN high-level meeting that took place on TB that many of you will be familiar with. At the time, we were really thrilled to see both the enthusiasm from academics and healthcare workers to engage in advocacy, but also the eagerness of UN missions to hear from these expert advisors alongside civil society voices. The work we did in 2023 was quite ad hoc, and one of the lessons that we learned was that it would be useful to coordinate joint recommendations from this constituency before the negotiations kick off properly. And we also saw that UN missions were really desperate to understand precisely how the 4 health-related UN high-level meetings that are happening in this space of 12 months interrelate so that they can avoid harmful silos and duplication. So last year, there were UN high-level meetings on tuberculosis, universal health coverage, and pandemic prevention, preparedness, and response. And this year is the UN high-level meeting on AMR. So how do those things fit together, and how do we make them work well together? Next slide, please, Georgia, if that's all right. Thank you. Building on that, we worked together with some partners at Cambridge University to convene the Global Scientific Panel on AMR and TB. The panel was made up of senior scientists and healthcare leaders from over 25 UN member states, each of whom brought their own expertise to the table, but also sought to collect input from their colleagues within national TB research networks, their colleagues working in AMR and TB wards to work out what the perspectives and recommendations from the broader community were. The group met over the course of 4 months and developed a white paper that focused specifically on the intersections between TB and AMR. How are these issues related? Why does the TB community need to see a successful UN high-level meeting on AMR rather than just TB? And perhaps most importantly for the negotiators who are leading the negotiations around the political declaration that comes out of the UN high-level meeting process, what kind of commitments on AMR will sort of hit 2 birds with 1 stone, addressing the full range of resistant pathogens that are wreaking havoc in agriculture, the environment, and all of human health, while also bolstering the commitments that were made at last year's UN high-level meeting on TB. As we said, the panel published a white paper to share with UN missions and partners. One of our panel members, Dr. Basra Tsogt from Mongolia, attended the multi-stakeholder hearing that took place in May. And we've been working with panel members to engage with UN missions and technical experts in capitals throughout the negotiations. And we also published a comment piece in the Lancet Global Health, which some of you may have seen, and I can post a link to that in the chat. I'll stop there, but we thought it would be helpful to give you a bit of background on what the panel was and how it worked. And I'll hand over to Dr. Georgesoulis, who can speak much more expertly about the panel's recommendations, as she was the member from Canada who joined the panel. Georgia, over to you.
Thank you, Yannicka. So essentially, the rationale for our work for the white paper was the recognition of the close relationship between AMR and TB. And Subash earlier has provided a very nice description of this. Just a couple of numbers. Approximately 30% of AMR-associated deaths are due to drug-resistant TB. So this is pretty substantial. And drug-resistant infections, more generally, not only claim several lives every year, but also cause substantial economic losses. And drug-resistant TB contributes to this. There are several drivers that are common to these two problems. And again, that is why we thought it could be important to highlight some of the areas where concerted action is necessary. So the scientific panel identified 5 key themes. For each of these, we provided specific concrete recommendations for action. Regarding prevention, first of all, we recommend making more efforts to reduce malnutrition, as this favors infections, and particularly drug-resistant infections, including drug-resistant TB. We also recommend strengthening infection prevention and control measures, as well as wash systems, as a way to reduce the spread, transmission of all kinds of resistance. We obviously support the principles of One Health, recognizing the interconnectedness between animals, humans, and the environment. But I want to spend a couple more words on the importance of improving the access to vaccines. Vaccination, by reducing the likelihood of infection, ultimately reduces the need for antimicrobials. And the use of antimicrobials is one of the key drivers of the emergence and spread of resistance. So ultimately, vaccination can affect AMR, and including drug-resistant TB. And this is true for all types of vaccines, not only those specifically meant to prevent bacterial infections. A lot of infections present in a very non-specific way. A good example is respiratory infection. It is often difficult to differentiate between viral, bacterial infections or other conditions. But the problem is that in many of these cases, there's often an inappropriate use of antimicrobials. That, again, is a driver of resistance. Regarding the specific case of TB, well, you probably all know that we only have one vaccine for TB as of now, the BCG vaccine, which has been in use for over 100 years and is not very effective. Over the past few years, we've seen some improvements in the TB vaccine development pipeline, and currently there are a few vaccine candidates that are under investigation in phase 3 clinical trials. So hopefully we'll have some good news in the coming years. A new safe and effective TB vaccine is much awaited. And this will not only have an impact on the incidence and mortality from TB, but it will also affect AMR more broadly, for example, by reducing the use of antimicrobials. Another important area identified by the panel is that of surveillance and diagnostic infrastructure. Let's say that funded strategies are necessary to ensure that effective and efficient surveillance systems are in place and are able to capture data on the widest possible range of pathogens. Capturing data on resistance is, of course, necessary, but this also needs to be associated with the collection and monitoring of data regarding antimicrobial consumption, which is currently one of the weakest parts of the system. And this needs to be coupled with national diagnostic strategies, funded strategies. Regarding the surveillance of antimicrobial consumption, as I said, this is one of the weaknesses. A recent systematic analysis on over 100 countries showed that about 40% of high-income countries and almost 70% of low and middle-income countries do not have data on antimicrobial consumption. So this is quite concerning. Our recommendations also involve access to quality treatment and antimicrobial stewardship, together with strengthened regulatory frameworks. As I mentioned before, one of the key drivers of the resistance is the overuse and the inappropriate use of antimicrobials. And this practice results from a variety of factors, such as inadequate training among healthcare workers or poor access to quality healthcare and quality medications, including antimicrobials, the lack of diagnostic tools that favors the empirical use of antimicrobials, regulatory weaknesses for sure, misconceptions around the role and impact of antimicrobials among patients, but also among providers. So all these factors need to be considered and need to be acted upon and need to be integrated with sustainable antimicrobial stewardship interventions that allow to let's say lead to an optimized utilization of antimicrobials, favoring the use of those antimicrobials that have the lowest impact on resistance selection. Our panel also placed a lot of emphasis on the importance of supporting and funding research and development. As a researcher, I'm particularly happy about this. But funding and supporting research is not enough if there are no efforts to ensure that new tools, that there is equitable access to new tools, and that after going through the pipeline, these new tools actually reach those in need as quickly as possible and are adapted to the local needs, the local context. And finally, we provided some recommendations regarding good governance for concrete commitments to tackle AMR, harmonized actions with other global health agendas, including SDG priorities, better public engagement, and this is something that Stop TB Canada is certainly working on quite a lot. Better mechanisms for multi-sectoral coordination, and of course, increased funding. So in conclusion, integrating the TB and AMR agenda is necessary, is the only way forward to optimize resources and results. There are a lot of lessons learned from TB, for example, with respect to surveillance, with respect to the drug supply mechanisms that can be leveraged to improve efforts towards AMR more broadly. So coordination is essential if we really aim to eliminate TB and to fight AMR in the coming years. Thank you.
Thank you both for sharing this important findings as well as recommendations, mainly around vaccine surveillance, also misuse and overuse of antibiotics, and multi-sectoral collaboration. These are all components that TB community has been shouting for quite a long time. And we are very much hopeful that these recommendations will be taken into consideration in upcoming meeting. Thank you so much. So now we'll be moving into our panel discussion. I'm very excited to hear from our panelists who will bring diverse and valuable perspective to this issue. We have two new panel members who will be joining us in this panel. So Dr. Ryan Cooper, he's an associate teaching professor at University of Alberta and Royal Alexandra Hospital, and Dr. Cherry Scott, who is senior strategy manager at United. So I would like to start the panel discussion with Cherry's, if that's okay with you, since we haven't heard from you two. So I think we should give more priority to hearing from you both. So Cherry's, you have an extensive experience in global health, particularly in advancing innovation, product, and strategy to combat the neglected diseases. So can you share how UnitAid is addressing the burden of TB and AMR? And what are the role of innovation that plays in overcoming these challenges?
Yes, I'd be happy to do so. And thank you for the organizers for inviting us to speak at this webinar. And we're very excited and very committed to this topic. Because as you know, millions of people in low and middle income countries are dying every year for preventable, treatable diseases because they can't access the life-saving health products they need. So UnitAid, which is a grant-making entity, we're hosted by the World Health Organization. We were created to address this inequality. So basically, we work to make sure innovations don't get stuck on their path to scale up and on their path to the people that need them. We were created in 2006, and since that time, we've unlocked 100 groundbreaking medical products that have helped address the world's biggest challenges. This includes HIV, TB, of course, and malaria, and women and children's health and pandemic prevention and preparedness. And so we really worked, we consider ourselves taking a boutique or tailored approach to access and equitable access. As you saw, that was one of the key recommendations from the panel. And we see that there's a definite need as you look at health innovations to connect the upstream with the downstream. And so there's a critical role that we tend to see ourselves playing in introducing new products and making sure that the prices are right, that there are adequate supply, that there's implementation research, working with countries, working with other stakeholders to make sure that health innovations actually reach those in countries. And so we really feel that there's a synergistic effect with other health actors. For example, often our work is transitioned to further implementation and scale up with partners like Global Fund. So our interventions can be taken up by countries and included in their funding requests. And then, as I mentioned, tuberculosis has been a core of our priorities since our inception. Right now, we have over 270 million invested in TB, and looking at how do we access key innovations for prevention, detection, and care. And our portfolio right now centers around advancing better, shorter TB prevention, therapy, and making it a reality for both children and adults, for both drug-sensitive and drug-resistant TB. We're also advancing projects to advance state-of-the-art diagnostics, and that includes work on targeted next-generation sequencing, which has traditionally been only available in high-income countries, but now we're trying to make that more available across the board and more broadly, because that's one technology right now we're using it, of course, to think through TB, but it has applications across multiple diseases. And that was also one of the recommendations, looking at how do we use our platforms and think multi-sectorally around this issue. And so we're advancing that project work on that, including with our partner Find, which I know has been quite instrumental, one of the product development partnerships that are key to health innovations in TB. In addition to that, we have several projects looking at bringing diagnostics, because one of the things is identifying people and getting them in order to get them on right treatment, you have to have appropriate diagnostics and detection tools. And so we're working to bring that to the lowest level and to the first entrance of people who are maybe at risk. And then another big component that I think is quite relevant here as well is that we have always recognized the importance of civil society leadership and community leadership to drive efforts on universal access to innovation. And so we're doing in real time, we're looking at planning new investments to help demand generations around the new treatments for drug-resistant TB, and thinking through how do we think through that in a holistic package of care, because it's not just a treatment, it's all the care that's around it that needs to be galvanized and brought to bear. And I think also TB has a place right now to be recognized as a pathfinder, or a way to how we can address AMR, because we have new regimens coming forward. We have new treatments now. How do we make sure that we're using and handling and doing things a little bit differently, so that we can truly advance on our objectives now, but also pay attention to what we need to happen in the future. So I'll leave it there. Thank you.
Thank you so much, Charissa. It's really interesting to know what United is doing in terms of the diagnostics, also in terms of access to the medicine and other areas. So we'll be definitely coming back to those areas later on. But I would like to move to Ryan. So Ryan, although Canada is not on the list of countries most affected by drug resistance TB, but you have been working in a public health, and you have involved in understanding and addressing a public health threat. So why the fight against drug-resistant form of tuberculosis is a concern to Canada? And what unique challenge does the country face comparing to high-burden regions or high-burden countries?
Thanks for the question, and also thanks you guys for the opportunity to be here. I appreciate it. And I'll try and be brief, but I do think MDR-TB is an important issue for Canada. I'm grateful that our incidence right now is considered to be low. That's a good thing, and we should be grateful for that. We see about 30 cases per year across the country, representing about 1 to 2%. This is MDR-TB in Canada, and almost all the cases, almost 100%, are affect people who have spent significant time or are born in TB endemic areas, or the foreign-born. So that's a good thing. But there's a couple of caveats to be aware of, that I think those numbers hide. One is that those numbers are delayed, right? I got those numbers from the 2023 PHAC report, and they reflect data from 2012 to 2021. We're just out of date. Our surveillance indicators lag, and that's, I think, an important thing we need to work on. So one, our numbers aren't up to date. The other caveat is things could change, and I think with all infectious, I know we have some communicable disease epidemiologists here who know better than me, but things can change quite quickly with infectious diseases. And so we have to be aware of that and stay on top of it. Some reasons why things might change with MDR-TB is because it's driven by patterns of immigration. We've recognized over the last couple of years, we've seen a larger volume of migrants to Canada, which is a good thing on whole, but presents this health challenge. And we're also seeing immigration from parts of the world where MDR-TB is really crucial. So something on our plate in several provinces of Canada now is seeing XDR-TB from evacuees from the Ukraine war. Wherever there's war, there's going to be poverty and social breakdown. It's going to amplify resistance, particularly MDR-TB. And so that's, we're being affected by that. So we need to stay on top of the data. We also are we'd be worried if, even though MDR-TB is low, if transmission if drug resistant strains did occur in people who were underhoused or in highly affected communities within Canada, we might start to see transmission within Canada, and that could amplify the problem. So we do have some challenges, and I think probably the big one in Canada is that complacency that comes out by our currently low rates, and that leads to lack of funding, lack of interest, and lack of preparedness. Just as an example about lack of preparedness, just touch on the fact that we still don't have access to adequate diagnostics for MDR-TB. So not everyone across the country can use XDR-TB, has access to GenExpert. We heard from Mr. Patel that the recognition of drug-resistant TB is quite prompt in his case, but may not be the case here in Canada. So maybe I'll stop there and take more questions later, but I think that's just a hint of our challenges here.
Thank you so much, Ryan. I think, you very much rightly highlighted the challenges that Canada is facing in terms of surveillance, as well as the new challenges that comes through the face of immigration and how Canada needs to handle those issues. So with these challenges, we'll definitely come back to you later on, but I would like to ask Georgia. Georgia, as a Canada research chair in communicable disease epidemiology, your research covers TB and AMR extensively. So I think this was also highlighted in the chat before, but that is something we were also meant to ask. So TB is now included in WHO Priority Pathogen List 2024, which previously was not. So what implication does this have for global burden of drug resistance TB, and what additional action needs to be addressed to the threat of drug resistance from your perspective?
Well, first of all, I'd say it's great news that it finally happened. When the first WHO priority pathogen list came out, I think it was 2016, I was quite disappointed to see that drug-resistant TB was not there. So this is a big signal. It really highlights some critical aspects and implications for global health efforts, including drug-resistant TB among critical priority pathogens, raises awareness, first of all. It shows that urgent action is necessary. This may lead to more funding, to more resources mobilized to tackle specifically drug-resistant TB. So it's a way to put drug-resistant TB in the spotlight, but also to underline the importance of coordinated efforts. So essentially what we've been talking about before, the importance of integrating the agendas for TB and AMR. We need public health interventions that are comprehensive. Prevention and infection control strategies have an impact not just on one pathogen, have an impact that is broader than that. And so, as well as strategies to optimize the use of antimicrobials that has effects beyond a specific pathogen. So it's important for drug-resistant TB, but it's important for drug-resistant infections more generally. After all, the WHO's list is like a call to action for countries to work together, to share data, to implement best practices, evidence-based practices, to better manage TB, drug-resistant TB, prevent the emergence of resistance. So I think that will be the impact of including drug-resistant TB in the list. We'll see.
Thank you so much, Georgia. I think it's indeed a good thing that TB is now included in the list, but it also shows how TB has been historically neglected because, even being one of the leading cause of death, it has never been included in priority list. So moving to Himanshu, again, thank you for such an emotional and moving story that you have shared about your experience, which is truly inspirational. But based on your personal experience with MDR-TB and your advocacy work with TB People Canada, what key message do you think you want the world to understand about the human impact of MDR-TB?
I think the human impact is that it is very difficult to deal with the treatment, and in order to have patients go through the treatment in a better way or support them, I think we all have to come together. The policies that we are making or the system that we are trying to create, they should have people with lived experience or the families of people who have seen TB from close, have their voices, have their insights to understand what policies can be made or how the importance of counseling can be pitched in. So I think that should be the key in terms of dealing with that.
Thank you, Himanshu. It is indeed, and I think we are seeing the change now where people who are survived, or let's say who have conquered TB and MDR-TB, are more into the floor, more into decision making, global as well as national level, and which is a very good direction that TB program is going on. And I think this is something that overall global AMR program should also proceed with, where the voice of those who have conquered the disease, who have survived it, should be heard more, so that the policy is more driven by the survivor rather than to the survivors. Thank you for that. So I would move now to Cheris and follow up with the question that the response that you have done. So given your focus on improving access to essential medicine and innovation in global health, Can you explain the importance of investing in research and development for new TB diagnostics and treatment, and how these innovation can change the landscape of TB care?
Yes, but happy to do so. Because we know that the existing tools have challenges and they're not enough. If we really want to reach and cure more people and prevent deaths with new and shorter treatments like BPAL-M and other oral treatment regimens coming down the line, we know that when we have a health innovation, it's an opportunity also for us to say, how can we do this better? How can we do this differently? Health innovation really gives us a moment in time to really do better and to reach more people and to make it better for those who are coming forward that may be affected by this really bad and deadly disease. And we know that R&D is the beginning of the chain to equitable access. You can't have access to something that doesn't exist. And so we do need investments and resources to come to bear that can really help to change global health. And we must provide those resources to advance innovations that are coming through different entities like product development partnerships. Like I mentioned FIND, I'll mention IAVI and TB Alliance and other organizations that are trying to innovate in TB and other areas that are critical to moving the needle and saving lives. And then we work with those to take those innovations, work with partners such as those to take those innovations and then move it up and bring the momentum to then go forward to scale up and implementation. And so we need all partners at the table to really make that happen. And so, yes, I'll leave it there.
Thank you, Cheris. It is indeed, and if we have to end TB, we have to have innovation and the new drugs as well as diagnostics, which is, quite happy that we are looking at new treatment that's being rolled out as well as new diagnostics that are being introduced. So I would like to move to Ryan and follow up on what you have responded before on the challenges. So can you elaborate on the barrier people with TB in Canada face in accessing the essential medicine, and what this means for the broader effort to combat MDR-TB in Canada?
Yeah, no, thanks for that question. People may not be aware that there are substantial challenges to accessing modern TB drugs in Canada. We heard, and I think that's an important part, by the way, of controlling antimicrobial resistance. Any delay in therapy that necessitates using some sort of bridge regimen, and that bridge regimen is going to be associated with all those toxicities and lack of prompt response that we heard illustrated already by Mr. Patel. So that delay in access is very problematic for the person who's affected or living with, who has the tuberculosis. That delay in treatment start is associated with toxicity, but also waiting for these drugs to come through prolongs isolation, which in Canada we isolate people with MDR-TB, and that's carries with it a significant burden for the patient. And so if there's any delay, what seems like a trivial delay, you might hear that, oh yeah, you can get the TB drugs if you fill out the right paperwork and ship and order them in. But what's not always appreciated, the delay can sometimes be up to several weeks long, which only prolongs, has an impact on the patient. Inadequate treatment of TB also can risks amplifying resistance. If we're adding one drug at a time because we're waiting for potaminid to come in, which is delayed by several weeks, we do risk losing or further acquisition of resistance. And we're seeing globally real concerns with bedaquiline resistance, actually. And so we want to make sure that we're treating treating MDR-TB appropriately so that we avoid acquired resistance to bedaquiline. I think what's also particularly troublesome about the decreased access to medicines is I think it's a solvable problem. It's not like there's not bedaquiline to be had in the globe. It's just that we can't get it to our patients. This should be a low-hanging fruit for policymakers and for government, but it's still a problem that seems to be intractable to solving. And but it's important anyway. Maybe we also face, you could just sort of ditto my answer for access to diagnostics, whole genome sequencing, expert. These are problems. And I'm worried that we're going to soon finally get access to rapid diagnostic testing for MDR-TB and finally get access to bedaquiline, only to find that now we need access to sutezolid and the next drugs because of bedaquiline resistance, and we'll always be one step behind anyway.
Thank you, Ryan. Yeah, emergence of bedaquiline resistance is something of concern because it's a new drug that we recently introduced and we don't have a lot to combat DRTB with. So I would also like to ask Yannicka now. Yannicka, with your background in global health campaign, what outcome do you hope to see from the UN high-level meeting on AMR this September, particularly concerning TB and AMR?
Sure, thanks. That's a big question. I think based on the discussions of the Global Scientific Panel and also what we've seen around the implementation of other UN high-level meeting declarations, I think there's really 4 things that we'd want to see come out of the AMR HLM process this September. The first is a strong recognition of the intersection between TB and AMR, kind of linking the 2 political declarations, reaffirming those commitments. And I'm happy to say that the TB community's advocacy seems to have paid off there because the current draft declaration does include that. I think we'd also want to see really measurable and time-bound commitments on areas of the AMR response that will have the greatest impact on TB. Across the themes that have been identified by the panel. And again, the current draft includes at least some of this, which is great news. And then I think something that we want to see every year is high-level attendance and new policy and funding announcements by governments, increasing resources for health workers who are working on these issues, as well as increasing funding for R&D, including through institutions like product development partnerships, bodies like Unitaid, to really set the tone for the years ahead, that the political declaration isn't just a piece of paper, that, you know, they're not legally binding documents. So we really need to get that sense of momentum going. And then in the same vein, I think we need a plan for follow-up action. And that really applies to the TB community too. We can't let these historic silos between TB and AMR reestablish themselves. So, you know, what can we do to ensure closer collaboration between TB and AMR programs in countries? And how can we work with advocates working on AMR to make sure that there are increased investments on these issues and not a kind of thinner spreading of existing resources across these priorities? One step that's kind of top of my list is that there is a commitment at the within the political declaration currently to explore the creation of an independent scientific panel on action on AMR. So, you know, something that we could push for is making sure that that is actually created and that TB is firmly part of that remit, so that we have an independent scientific panel that reviews progress and makes recommendations on how to tackle all AMR pathogens, including TB, on a regular basis, to really strengthen that governance. So yeah, I think that's my wish list. We'll have to wait a little bit to see whether those wishes will come true, but we can all do stuff to make it more likely to happen. And I know that Lee's been posting kind of asks and things that folks can push for. So do those.
Thank you, Yannicka. It is indeed. And following up after the meeting is definitely TB programs should do, so that there is a collaboration between TB and AMR. So with this, we are into of our panel discussion. We have, I think, time for one question from the audience, because, you know, we are moving close to 1 p.m. Time. So if there is any question, please feel free to, you know, unmute yourself and ask. Or if we have any question in the chat, Lee.
There seems to be one question from Michelle. I'm not sure if you wanted to unmute and say your question verbally.
Oh, hi there. Yeah, thanks for the excellent presentation. Yeah, my question was around, I think it's been partly addressed by some of the comments, but, you know, thinking about the success we've had with something like CEPI for immunizations as a global fund to really help drive that innovation and as well as new development process and access. And I think we have part of that with Unitaid, but I don't know if it has the same draw of funding that we've gotten with CEPI. So what would you see that it would take to get to something like CEPI for TB?
Cherise, you are on mute if you are talking.
No, I didn't know if we could just go straight into answering and everything. One of the things that we recognize is there are several mechanisms along the value chain of access and innovation, where we already have several pools of funding and resources available. But one of the things we are trying to do within the TB community, which Unitate helped facilitate recently with partners, is to think end-to-end. We call it end-to-end thinking around innovation and access, and working with partners to say, can we agree as early as possible on what our targets are, what are the resources needed, who is committing to what along this value chain, so that we can ensure that there aren't any gaps or things that fall through the cracks as our innovation moves from those who are developing it to the access space, to countries and implementation. And so there's so many people along that value chain. And I don't think we need to necessarily create something new, but we do need to align and coordinate much better. So I would leave it there. Thank you.
Thank you, Cherise. So with this, I would like to thank all my panel members for their, informative and wonderful talk. And I would also like to thank the organizer to make me the moderator of this webinar. Over to you, Petra.
Thank you all. Thank you for the fantastic moderation, Suvesh, and each panel member you brought in your unique perspectives, and really very much appreciated. On behalf of Stop TB Canada, the network, just so that everyone knows, please join our network. This is an opportunity for you to not just talk about TB and AMR as we did today, but to really be involved in access to TB medication within Canada, more push for R&D and support mechanisms and health systems within Canada to strengthen really the base for ending TB within Canada and abroad. That's what we're working on as network. So please join us. I want to, as network also do a lot of advocacy, we're going to leave a click to tweet in the chat, which we all really encourage you to do, because all our voices together will put the pressure on the various platforms where we need to be heard. So please tweet today, send your message across and join Stop TB Canada. Thank you to everyone for joining. It was great to see all of you and the questions in the chat. Appreciate all the panelists and speakers for the fantastic content. And Lee, thanks for all the organizing. Well done, everyone, and have a wonderful rest of the day. Thank you and goodbye.
Thanks, everyone.
Thanks, bye.
Bye. Thank you. Good work. Bye-bye.